My personal belief is there are huge benefits to joining the forum. It allows you to network with other nurses who are familiar with your specialty. So they really get the nuances of what it's like to work in emergency care settings. It also allows them access to be able to influence strategy development that we do as part of that forum, as well as being able to respond to consultation on things like national guidance. So it is a real opportunity for individuals in emergency care to influence that national agenda. So in the last couple of years, our real kind of great achievements really started with the development of the baseline emergency staffing tool, known colloquially as BEST. It was the first tool that used a validated dependency scoring tool to be able for people to be able to look at their nursing workload in an emergency care setting and use it to strategically develop the staff base to respond to that workload. That has evolved as we've now developed the National Competency Framework for Emergency Nurses. There's level 1 and level 2, so for foundation staff nurses who are maybe newly qualified or new to specialty, the level 1 competencies would apply. Or for those who are more experienced in that field, in emergency care settings, they could do the level 2 to become emergency charge nurses and beyond. So there is a career framework within that to take you right to nurse consultancy or head of nursing level posts. And that framework really has been taken up and used in various guises, whether that's through higher education institutes to develop curriculum and modules at master's level based on those, or whether that's locally in-house to kind of aid the induction into emergency departments. So I'd say those are our two achievements in the last few years that we're proud of. So currently, based on the success of those pieces of work, we're now trying to kind of move those further into the 21st century and make those available on digital platforms, because really having a PDF and printing off documents is just not useful in today's world. So we're looking at developing both the staffing tool and the competency framework into kind of an app really that can be used real time on the shop floor. As well as what we're hoping to develop is the support worker competencies, so that real key kind of component of the workforce that are not registered nurses but clearly have skills and competencies to offer, and defining what those should be at the various levels, and that is work in progress. At our last strategy day, we looked at kind of our purpose really and why we exist. And it's our belief that patients with clinical emergencies really do deserve to be cared for by emergency nurses. And so the professional forum is there to guide the development of that specialty, whether that's advances in practice development, and we would do that in cooperation and coordination with medical colleges and allied health professional colleges, or whether that's developing the research evidence base, and we network with key individuals and professors around the country in emergency care to try and advance that research evidence base, or whether that's advancing the educational element of the role through things like the competency framework. So the strategy really is to develop the specialty of emergency nursing.